Welcome to our show, Coffee with Chris. Our mission is to provide you with home care tips, education, and resources to ensure you receive the quality care you deserve in the comfort of your home.
Welcome to our show, Coffee with Chris. I'm excited to share with you a really important topic today. We're going to be talking about preventing falls in the aging population, in the elderly community. It's really important that we share our stories and we resonate this to our caretakers out there and our family members who are taking care of the elderly. And if you are experiencing anything, we love you to come on to our podcast show and share your story with us. Please comment, share, and follow our podcast. And if this resonates with you or anybody that inspires, please share our podcast show to somebody that we can help. So today we're going to be diving into preventing falls. And I really wanted to express how important this is because, the Centers of Disease Control and Prevention, labels falls as the leading cause of fatal and non-fatal injuries among older adults. Research does show that more than 1 out of 4 Americans aged 65 and older falls each year. This is unbelievable. This is a lot of hospital readmissions. A lot of people are going into the hospital because of the falls in all different ages, but especially in the aging population. Can you imagine that you didn't witness your loved ones fall and they didn't have any cuts or bruises and you didn't know exactly what was going inside their body, or if there's any type of, anything wrong inside? It could be a brain injury, or any type of fractures that could happen, and you didn't witness that. And so you have to submit them into the hospital to be able to see exactly what's going on. So, even if an aging loved one falls, but doesn't sustain any fall-related injuries, which include like a hip fracture, like I said, a traumatic brain injury, these accidents take a toll on our seniors' self-confidence and everyday routines. See, the fear of falling often deters older adults from performing activities of daily living and engaging in their pastimes that they once enjoyed. So resulting in a decline in quality of life and physical activity starts to happen. It really is important to learn how to prevent these falls. I mean, these falls can occur for many different type of reasons. Okay. But there are several simple preventative measures. I hope this resonates with you. And I hope this podcast shares, you can share this with somebody that maybe your parents too, as well. They can hear this and they could set up the right home environment. And this can significantly reduce a senior's risk of falling and incurring a serious injury. Taking these preventative steps will help ensure you and your loved one that remain safe in their home and independent as possible for as long as possible. So we're going to dive into it today. We're going to talk about some tips, and I hope this helps out. So we're going to talk about setting up your home as a fall-proof home environment. So most falls are caused by, tripping, loss of footing, and or traction or slipping. Okay, so associated with environmental hazards. Now, an ideal fall-proof home features even in non-slipped walking surfaces throughout this happens. Okay, so while this may seem unattainable, especially for those living in multi-level residences, okay, they are not safe. There are minor changes that you can make, and there's some home modifications that we could suggest that can help reduce elderly to be labeled as a fall risk. All right, so one is keeping all the rooms free of clutter, especially the floors. All right, the furniture. This is so important. I know that the home decor is going to be really special to, your parents, and they're not going to want to make many changes, and they like the way everything is laid out, and it's not an easy sell, that's for sure. But furniture must be easy to walk around. All right, and then the walkways should be clear. All right, and then this means electrical cords that are laid out around, any type of throw rugs. These are all considered trip hazards, so they need to be cleared out. The surfaces, making sure they're not slippery. All right. And then checking the carpets and the area rugs. Have skid proof backings or a firmly secured floor, and including carpeting on stairs, right? So, the I know that the carpeting on the stairs, it looks nice and everything, but when you're talking about home environments and if it's safe, technically, actually, it's considered a hazard. So be sure also your stairwells, when you're looking at your stairwells, that's adequately lit and they're sturdy. Your mom and dad might be going up and down the stairs. They might be wanting to get a drink of water, and this handrails, that's great on one side, but they got to be secure on both sides. So consider placing contrasting type of fluorescent tape sometimes on the edges of each step so they can avoid a misstep. Some family members don't think that is a good tip. I have seen lots of value in that too. So grab bars in bathrooms, right? And beside the tub, in the shower, and right near the toilet, right? For those who get tired easily and fatigued and are very unstable on their feet, you have to consider possibly when they are showering that there is a shower chair or a transfer bench. This is for increased stability when they're bathing. They're getting tired. You notice your parents are fatigued and they can't stand for long periods of time. These are all red flags. Use a non-slip spray treatment or a permanent non-slip strips to provide extra traction so there's no slipping in the showers and the bathtubs too. Okay, make sure they're not movable. All right, so this is something that you got to test out. Ensure that there may be possibly the light switches that are located near the entry points of each room to prevent any type of fumbling in the dark. There's lots of ones that are like, motion activated, or you can install voice activations as well too. Lamps. This helps out. So when they're walking, they're not walking in the dark. They know exactly where they're walking. This is a really good way to be able to prevent a fall. Reorganizing the closets, the cabinets, and other storage areas to minimize the need to bend down, okay, or reach to retrieve commonly used items. Okay, it's important to understand that it's not easy to tell your parents to be able to change things up in their home. I get it. Trust me, I struggle now. My parents are not, very independent right now, but I deal with a lot of our clients, and to be able to slowly reorganize those areas, those storage areas, so that way, you can make it a little bit easier for them to get things, make it more accessible for them. So they don't have to reach and grab and bend over, because this all causes, loss of mobility and stability. So let's talk about the type of footwear. All right. So footwear, everyone knows, your parents have that favorite slipper, but it looks a little bit worn out. They've had it for so many years. They don't want to switch it. Or it could be not even fitting, ill-fitting, or impractical type of style. Really, that's really considered a serious fall hazard. So it's important to understand that getting supportive, low-heeled shoes with or possibly non-slip soles are considered really ideal. So purchasing 2 pairs is the tip. Okay, so one for the inside of the home and one when they're out and when they're in their outings wearing. So it's I know that possibly, again, they may be resistant about this, but when they're walking around the house they're wearing their socks. Are they wearing stockings, or they have backless slippers that are giving them support? These are all, different type of tips when discussing, appropriate footwear for your parents. Now, another tip I want to encourage is physical activity. Physical activity is so important, and getting regular physical activity is the first line of defense against falls or fractures. So as people get older, they typically become less active, right? And they begin to lose muscle mass and tone. Okay, so this leads to a decrease in strength, coordination, and flexibility, and an increased fall risk. Now, talking to your doctors and your physical therapist and your occupational therapist and creating a good exercise program is going to be super vital for you and your parents. Then this helps improve their stamina, their balance, their mobility. And this could improve anybody regardless of their age. Another is mobility aids, right? Used prescribed mobility aids. So like elderly often are very reluctant to get mobility aids, and they can be very hesitant on that, like their walkers and their rollators and their canes. And so these devices do play a huge vital role to control, lead into a safe environment to have and also have an active lifestyle too. So it's important to ensure that you have proper mobility and how to use it correctly. Your physician, your therapist, your physical therapist, your occupational therapist, your home care specialist, whoever it is, they need to recommend you to the right durable medical equipment company, and also talk to your physician about getting a script. Typically, Medicare Part B does cover DME, and it's called durable medical equipment. And they could prescribe, a physician could prescribe that, and you could possibly get that covered. So it's good to be able to discuss that. And I highly recommend first starting out with getting a walker, a rollator, and a cane in the home. Okay. Now, eye exams. Now, even small changes in sight can be a big deal, and seniors are more prone to falling by not getting their regular eye exams. So you need to encourage your parents and your family members to get, what type of eyeglasses are they wearing? Do you know if your parents have low vision? And so so they can see their surroundings clearly, it's going to be a vital part of understanding and getting their regular eye exams. It's crucial to understand if they have any type of eye diseases or they need to correct their prescription. So if your parents need new glasses, you need to encourage them to be able to be extra cautious while they are getting accustomed to them, right? For example, if they are getting brand new bifocals or trifocals, the progressive lenses, usually these lenses distort vision and their depths of perception while they're walking. So this makes it a little bit easier to someone to lose balance and fall. I'm not sure if you ever tried wearing one of those. It's extremely hard to be able to, to walk, and it offsets your balance. So to prevent this, practice looking straight ahead. This is what you do when you do have, your parents who have the bifocals, the trifocals. Practice looking straight ahead while walking, right? And lowering the entire head when looking at the ground, instead of gazing through the lower parts of the lenses. All right. So when they're looking through the lower part of the lenses or the upper part, it's going to be a big difference. And do they know how to be able to navigate that? Another important tip to understand is that the medications, and checking the medications for any type of side effects or any type of adverse interactions or reactions that are going. I said that wrong. Adverse drug interactions, right? So as people get older, they are more likely to suffer from a variety of different type of medical conditions. They do have things that are coming up as we age, but they must be managed correctly. And research does show that the median number of medications that are taken by older adults is around 4, right? So it's estimated that between 30 and 40% of seniors take 5 or more prescriptions. I've seen 10, I've seen 15, all of which can have side effects and also potential of adverse drug interactions, the more medications that they're taking. Do you have a good relationship with your pharmacist and your physician? Do you know exactly what your parents are taking? Do you know if all the medications in their home is managed by a pill organizer and that they have a good daily routine of when they're taking it? Do they have a medication reminding system? Seniors with illnesses that typically, that affect their circulation, it can affect their sensation. Usually it could also affect their mobility or mental alertness. So it's important to understand like what medications they're taking, or they're just more likely to fall. Now, there's certain prescriptions also that cause side effects, like, for example, dizziness, confusion, drowsiness, fluctuations in blood pressure, or slowed reflexes. This contributes to falling and causing accidents. So another tip, and the last tip I really wanted to go over with you, how important it is really is that consulting with your physician and understanding falls and fractures are not inevitable, and it's not an inevitable part of growing older, and many can be prevented by just making these a part of your lifestyle and discussing these with your parents, and how important it is for them that you want to see them live a long, happy life, right? And safe life too, so they can be able to enjoy it with you. Your loved one's doctor can assess the risks of their falling. You could bring them, and you could have also a home care specialist come out and do a fall risk assessment, and suggest all these personalized different type of strategies, and talk in person, and to improve their mobility and the prevention of having an injury. Evidence-based fall prevention programs are extremely important, and I think that you can easily help your parents understand the value of changing their home modification, their understanding their medications, and when they're showering and they're going to the bathroom, and if they have their eye exams, all these things can be prevented, and you have to be super involved with your family. I hope this resonated with you guys. This is just some tips to be able to help you out with your loved one and to help prevent falls. And so we'll see you in the next podcast. And if this has resonated with you, or somebody that possibly we can help, please share our podcast with them and follow, and please comment as well too. Thank you for coming to listening to our show today, and we'll see you in the next podcast. Take care, and we'll talk soon.
Welcome to our show, Coffee with Chris. Our mission is to provide you with home care tips, education, and resources to ensure you receive the quality care you deserve in the comfort of your home.